Okay, so let's proceed to the third lecture for this morning. Okay, so we have the epidemiology of tuberculosis. The objective at the end of the session, the student should be able to know the global and Philippine burden of TB. Okay, so and then explain the policies and guidelines stated in the National TB Program Manual of Operating Procedures. I uploaded a copy of the National TB Program Manual of Operating Procedures so that you can peruse the manual, and if you want to do further readings on the program of TB in the Philippines, you can read that PDF file in Canvas. For the global burden of TB, a total of 1.5 million people died from TB in 2020, including 214,000 people with HIV. So worldwide, TB is the 13th leading cause of death and second leading infectious killer after COVID-19. Okay, so dati, first, ang TB. Okay, but with the advent of COVID-19, naging second na lang yung TB. Okay. So in 2020, an estimated 10 million people fell ill with TB worldwide. 5.6 million men, 3.3 million women, and 1.1 million children. So TB is present in all countries and age groups. TB is curable and preventable. So MDR-TB remains a public health crisis and health security threat. So only about 1 in 3 people with drug-resistant TB access treatment in 2020. But that is not the case in the Philippines. So since we have free MDR-TB drugs, so marami na may nakaka-access ng MDR-TB treatment in the Philippines. But we do have a lot of MDR-TB treatment cases in the Philippines. Impact of COVID-19 on TB. So most immediate obvious impact of COVID-related disruptions is on TB. So we show a big global drop in the number of people newly diagnosed with TB and reported. So from 7.1 million in 2019 to 5.8 million in 2020. So that's an 18% drop from 2019 to 2020. So does it mean that there are less people who have TB? That you cannot presume that that is the case. Why? Because during this time, 2019 to 2020, that's the time that there are lockdowns in almost all countries in the world. Okay, and because of that particular lockdowns, people who have TB were not able to go to the health centers to have themselves diagnosed with TB para check up. Okay. So because people are not going to the health centers for diagnosis, for checkup, then there was a drop in the number of newly diagnosed TB. Okay. So 16 countries accounted for 93% of global drop. And third is the Philippines with 12% drop in the number of cases in 2020. TB mortality. So global number of TB deaths increased in 2020. And sa makikita nyo nag-increase yung deaths in 2020. So the number of cases decreased, but the number of deaths increased. Why? Again, because people were not able to go to the health centers to get their medications. So wala silang gamot. So lumala yung mga sakit ng mga patients. And that's why more people died because of TB during the COVID-19. So these are the epidemiology categorization of countries and territories based on incidence per 100,000 population per year in 2019. So Philippines goes on the top. And so severely endemic, 500 new cases and relapse cases per 100,000 population per year ang Philippines. So the Philippine burden of TB, we are third of 30 high burden countries. So parang rin sinabing third in the world. Okay, because when you say high burden countries, these are the countries, the top 30 countries who has problem with TB in the world. Okay, so we are third in the world in terms of TB incidence. Okay, we are 17th of 30 high burden countries in terms of TB HIV. So I think may TB ka na, may HIV ka pa. And 7th of 30 high burden countries in terms of MDR-TB experience. This is an improvement already. When I was still with the Philippine Tuberculosis Society, when I was still the director of the Philippine Tuberculosis Society, we are fourth. Fourth tayo in terms of MDR-TB incidence. Yan. Pero ngayon, medyo nag-improve, 7th na lang tayo. Pero still. And in 2020, TB is the leading cause of death in 2020 in the Philippines. These are the global targets for TB. Medyo malabo nating ma-achieve yan, global targets. So, yan. Natural history, agent is Mycobacterium TB, reservoir is humans, mode of transmission, airborne droplet, direct transmission, incubation period 2 to 10 weeks. Period of communicability as long as viable tubercular bacilli are being discharged in the sputum. Specimen is the sputum. Okay, that is the reason why before, during the 90s hanggang early 2000, 2010s onwards, ayan, we do not really treat TB patients, okay, in the Philippines. Why? Yung program natin, you will only be given free medications for TB if you tested positive for the sputum exam. Okay? And bakit yun lang? Kasi those who are tested positive in sputum exam, sila yung communicable. Okay? They are the ones spreading TB. Okay? So it's a known scenario in the Philippines that 7 out of 10 Filipinos has TB. But not all of them are symptomatics. So they have TB, but they do not have symptoms of the TB, and their sputum exam will be negative. Okay, so they are not being treated for TB, but they do have TB. This is the 2020 National Tuberculosis Control Program, Manual of Procedure, 6th edition. Okay, so katatapos lang namin sa ulo yung 5th edition, then bigla na naman naglabas ang Department of Health of the 6th edition. Hopefully, sana masaulo namin siya before lumabas yung 7th edition. What is new in the 2020 MOP? So emphasis now is on patient-centered care, okay? And it already includes guidelines for MDR-TB. Okay, so dalawa na siya. Drug-susceptible TB or yung ordinary TB and drug-resistant TB is already included in the MOP. And there's also a guideline now on preventive treatment. So they included preventive treatment in the guideline. Eto medyo questionable to para sa akin yung preventive treatment of TB. Mamaya I will tell you why. For screening, there's also an improvement in terms of screening. Before, hanggang dun sa PIF, MOP, we have passive case finding. What do you mean by passive case finding? Ano lang tayo sa health center? We're just sitting in the health center. We'll be waiting for patients who will complain of more than 2 weeks of cough. Okay, so pag more than 2 weeks of cough ang complaint of patient, then we will ask the patient to do sputum exam. If he tested positive for sputum exam, then he will be given TB medications, and that's it. Okay, so that's passive case finding. That's how we diagnose TB before. We just wait for those who have symptoms to go to the health center. But now, with the 6th MOP, hindi na tayo passive. Okay, we have intensified case finding in health facilities, active case finding in targeted communities, workplace, and congregate settings, and enhanced case findings or systematic screening in communities using symptom screening such as house-to-house visit by community workers. Okay? So yung active case finding natin, eto yung mga target communities. Sino yan? TB in prison, TB in the workplace, with a CAP, and sa school. Okay? So active case finding, we ask them to do chest x-ray. Mapapakita ko sa inyo ano yung paano ginawa yung case finding. We also have enhanced case finding now. We ask barangay health workers to do house-to-house visits with the screening form, ask patients, ask yung households, meron bang inuubo for 2 weeks, then do the exam. Okay? And intensified case finding in the facilities. Ano yung ibig sabihin intensified case finding in the health facilities? Instead of passive case finding that you are only waiting in the health center. Now, if you see a TB patient in the health center, may nakita ka ng TB patient, the target's not anymore just the TB patient. Then you have to go back dun sa household and then do testing of all members of the household. Okay, so that's intensified case finding. So this intensified case finding, so ask for signs and symptoms ng household members. Kung meron and wala, then kung wala, do chest x-ray. If the x-ray finding is suggestive of TB, then diagnose as presumptive TB and request for expert MTB. If the patient has signs and symptoms, then diagnose as presumptive TB and then request for expert MTB. Right? Okay. So now, hindi na sputum exam. Before the diagnostic procedure, standard for TB is sputum exam. It's not sputum exam anymore. We are now, the standard now is expert MTB. I will show you later on ano yung expert MTB. And this is yung active case finding. Again, sabi ko nga this includes yung TB in prison and TB in the workplace. So screen all by chest x-ray. If suggestive of TB, then request for expert MTB. If not, then end of evaluation. So this is expert MTB. Expert MTB is actually a diagnostic procedure to detect if the patient is resistant to rifampicin. Okay. So before, we only use expert MTB to diagnose MDR-TB. So pang MDR-TB lang siya before. But with the 6th MOP, the expert MTB is now used to diagnose TB per se. It's not anymore just for for MDR-TB, but for TB per se na. Okay. So pag T, then Mycobacterium tuberculosis is detected with no resistance from rifampicin. So hindi siya MDR-TB, that's an ordinary TB, then treat as ordinary TB. If RR, then there is resistance from rifampicin, so treat this as MDR-TB. Okay. Kung TI, then yung rifampicin resistance is indeterminate. You have to repeat the exam. Okay. Pag N, so MTB is not detected, so meaning the patient has no TB, then let the patient go. And pag I, invalid or no result or error. But nagkakaroon pa yun ng I. So the I is for those patients who finds it difficult to expectorate sputum. And they are submitting saliva as a specimen. So pag saliva yan, you would not find anything in there. So kaya invalid yung result. We do still have yung TB lump. Okay, so pero nag-change na rin. So this is sputum microscopy and TB lump. So nag-change na rin siya. Before, we asked the patient to submit 3 specimen. Now, 2 na lang. So 2 specimen na lang. Okay, before, you need to be positive in 2 specimen out of 3 to be declared as positive for TB. Pero now, just 1 sputum smear positive is enough to get a diagnosis of PTB. Okay. So negative siya if both sputum smears are negative. Diagnosis of TB in children. So for TB in children, we still use chest x-ray for TB in children. And then after x-ray, then expert pa rin. Okay. Kasi sometimes it's hard to get sputum sputum specimen from children. So if you are having a hard time getting sputum specimens to children, then that's the time that you will use x-ray. TB disease registration, so it was simplified. So mas simple na siya ngayon. There are only 2 things that you have to look into. New case, is this a new case or a retreatment case? Okay. So ano yung difference between a new case and a retreatment case? So yung months lang, gaano katagal siyang naggamot before? Okay. So if the patient received treatment before for at least 1 month in the past, then that's a retreatment case, regardless of the outcome of the treatment. So pag at least 1 month, then that's a retreatment case. New cases, aside from yung talagang have never had any treatment for TB, or those who have taken anti-TB drugs for less than 1 month. Okay. So these are the different types of retreatment case. When you say relapse, these are previously treated TB and declared cured or treatment completed, but now diagnosed again with an active TB. So that's a relapse. Treatment after failure, you can only see treatment after failure dun sa mga nag-start na positive for TB. So nag-start silang positive for TB, and then after 6 months, you test them again for sputum exam, and then positive pa rin siya. So meaning, there's no seroconversion that occurred from positive to negative, so positive pa rin siya. Then that is treatment after failure. So nag-fail yung treatment sa kanya. Pag treatment after failure, then we consider this as MDR-TB. Okay? So we start them on MDR-TB treatment. Treatment after loss to follow-up. So the patient started treatment for TB, but did not complete the treatment and lost the follow-up for at least 2 months in the most recent course. So dapat at least 2 months yung lost the follow-up. Yeah. Previous treatment outcome unknown, previously treated for TB but whose outcome the most recent course is unknown. So sino mga to? Ito yung mga hindi nakapagpa-sputum exam. Okay, so we do not know if there's zero conversion or not. Okay. And patients with unknown previous TB treatment history. So yung hindi mag-fill up dito, mag-fit in any of these, then ito siya papasok. So example, this is what I will give dun sa exam. So ito mga ganitong style ang bibigay sa exam. Okay, so Desha was diagnosed with TB last January when he consulted because of persistent cough. He was started on a standard treatment regimen. He took the treatment for 2 weeks but discontinued because he noticed a change in the color of the urine. So now, bumalik siya kasi meron siyang nararamdaman pa rin and he tested positive again for TB. So what will be his category? Okay, is it a relapse? Is it treatment after failure? Treatment after loss of follow-up? Previous treatment outcome unknown? Or new smear positive? So this one is a new smear positive. Why? Because yung previous treatment is for 2 weeks only. But I told you earlier, if the treatment is less than a month, then kahit na nag-treat na yan before, you still consider that as a new smear positive. Or a new case. How about drug resistance? So we have different types of drug resistance. We have mono, poly, multi-drug, and extensively drug-resistant TB. Mono resistance means the resistance to one anti-TB drug. So isa lang ang kanyang resistance sa nagamot. When you say polyresistance, we resistance to more than one anti-TB drug other than isoniazid and rifampicin. So pwedeng resistance siya sa rifampicin and pyrazinamide or isoniazid and ethambutol. Okay, but not both isoniazid and rifampicin. So that's polyresistance. MDR-TB on the other hand, resistant siya for both rifampicin and isoniazid. Okay. There's a problem there with our diagnostic procedure. So in the diagnostic procedure natin, the expert MTB, as I told you a while ago, for expert MTB, we only diagnose patients who are resistant from rifampicin. Okay. So if we are only using expert MTB per se, dapat mono-resistance lang siya. That should not be multi-drug resistant. But then again, we are assuming that if the patient is resistant from rifampicin, then he or she is also resistant to isoniazid. That is the reason why with just expert MTB, we classify them as multi-drug, as MDR. Then extensively drug-resistant TB are those who are resistant, to other, resistant to other anti-TB drugs. So ito yung mga drugs used for MDR-TB. Okay, so kung resistant ka na sa mga drugs used for MDR-TB, then magdasal ka na lang kasi wala nang magagawa sa'yo. How can we treat you if you're resistant to all the other medications pa rin? Treatment regimen is also simplified. So we only have 2 regimen now. Okay, so one is 6 months treatment, the other is 12 months or 1 year treatment. So mas simple na rin. Before, iba yung treatment for retreatment, iba yung treatment for extrapulmonary. So before we have 1, 1A, 2, 2A, 3, 3A. Okay? Iba yung for na-diagnose na siya sa X-ray but negative for sputum, iba yung treatment before. Now, para mas simple, dalawa na lang. Okay? So what's the difference between the two? Regimen 1 is pulmonary and extrapulmonary TB except central nervous system, bones, and joints. While regimen 2 is for extrapulmonary TB. Okay? So yun lang. Pag extrapulmonary, regimen 2. So 1 year gamutan. If it's normal TB or pulmonary TB, then 6 months yung treatment. Treatment outcome. Cured is for patients who had seroconversion. So these are patients who tested positive initially, then at the end of 6 months, tested negative. So na-convert from positive to negative. Those are patients who are cured. Okay. How about treatment completed? Treatment completed are for those diagnosed through X-ray and wala silang sputum microscopy at the beginning. Okay, so no sputum microscopy at the beginning or sputum negative. Okay, so we cannot designate them as cured kasi negative to negative, hindi naman nagkaroon ng seroconversion. So, still negative. So, both are negative. So, treatment completed lang sila or completed the 6 months of treatment. Siyempre, di ko na sabihin. Failed as opposed dun sa cured. So, positive, negative ang cured. Failed is positive, positive. Okay? Then, lost to follow-up na wala. Not evaluated. Again, these are the people who we're not able to give sputum exams at the end of the treatment. MDR-TB, so as I told you earlier, the new MOP already has guidelines for treatment of MDR-TB. So ito yung way that we treat MDR-TB. TB prevention. Ano yung TB prevention? So this is given for PLHIV aged 1 year and older, regardless of history of contacts of people living with HIV. All household contacts of bacteriologically confirmed TB. So regardless of the regardless, pag negative sila sa expert MTB, they are still going to be given medications if they are household contacts. Children less than 5 years old who are household contacts of clinically diagnosed TB, close contacts of bacteriologically confirmed TB outside the household, and other risk groups. Okay, so this includes yung sa workplace. If you're exposed to a TB patient sa workplace, then you are eligible for TB preventive treatment. Okay, so what's a TB preventive treatment? So ito siya. Ang available lang sa Philippines, the 6H or the isoniazid daily na treatment. Okay? So, bakit ayoko nito? Why? Because we already have a lot of cases of MDR-TB. And it's already proven before na yung ginagawang treatment before of pediatricians of giving isoniazid. So, ang tawag pa nga dyan before is vitamin sa baga. So, when you become doctors, you will see a lot of patients who will ask you, Doc, pwede bang humingi ng vitamin sa baga? Okay? So, yun ang tawag nila sa isoniazid, vitamin sa baga. It's not actually a vitamins for the lungs. Isoniazid is given as treatment for TB. Okay, so yung mga pediatrician before, left and right, they are giving isoniazid for the treatment of TB even if the patient has no TB. Okay, so and that's the reason why we have also a lot of MDR-TB because of that particular practice. And it was evidence-based that this can cause MDR-TB. But now, ito yung pinopromote nila. So parang dadami yung MDR-TB natin pag ganyan. So these are my reference for the lecture, WHO Global Report on TB 2021, and again, the MOP, 6th edition MOP. And so in summary, I discussed the global and Philippine burden of TB and the Philippine program for TB. Yes, do you have any questions? If you have any questions, again, please write it down and then ask them to me probably next week during the lecture of Dr. Arnailes or during my lecture on disaster. Okay, so thank you very much again for listening. So this is the end of the 3 lectures for this morning. Okay, so there. So good luck, everyone. And again, good morning.